I've been losing my belly, but I haven't been losing all the things I love, because I've become a swapper. I've been swapping big for small, swapping sitting for moving, swapping watching, playing.
There you go, Eric.
And swapping often for sometimes. Once I got into it, I found it was easy.
To help lose centimetres without losing out, you don't have to stop it, just swap it. So start swapping today. For more tips, visit australia.gov.au/swap it. Authorised by the Australian Government, Canberra.
The Swap It campaign is simply swapping things that you are currently doing for healthier options. Swap It campaign promotes healthy eating and getting active to help lose centimetres and prevent or delay the onset of plentiful chronic diseases such as some cancers, type 2 diabetes and heart disease. You don't have to stop it, just swap it. For example, swap inside for outside, big meals for small meals, swap sitting for moving, and swap takeaway for homemade.
The Ottawa Charter was developed to help promote health worldwide. Health promotion involves activities that are aimed at enabling people to increase control over their health to improve their health and prevent illness. The two main aims for health promotion is to achieve better health for all and to prevent future illnesses occurring. There are 5 main action areas of the Ottawa Charter. These are developing personal skills, creating supportive environments, strengthening community actions, reorienting health services, and building healthy public policies.
Developing personal skills focuses on individuals becoming responsible for their health choices. When relating to health promotion, it means that individuals become able to make sound decisions and develop skills to practice positive health behaviours based on currently available health information.
The Swap It campaign initiative helps educate and make individuals aware of the risk factors that contribute to cardiovascular disease, diabetes and cancer. It clearly outlines why these risk factors are affecting Australians and how individuals can fix this and take their own action to prevent the chronic disease affecting their life by easily swapping unhealthy behaviours for healthy ones. An example of this includes swapping sitting for moving. The campaign makes the challenge to people to swap these unhealthy behaviours and empower in making their life healthy, otherwise they will not be around for much longer due to chronic disease. They will experience from poor lifestyle choices resulting from being overweight. The media advertisements are presented in a fun, carefree manner which suggest how easy and beneficial these changes will be to that person's life. They will also create discussion between individuals about healthy behaviours and therefore further promote these healthy practices. The Swap It website is very easy to navigate and understand, as the wording is very simple and straight to the point, allowing all people, no matter what background, to understand the messages conveyed, as they have translation for all languages. However, if an individual did not have a computer, there are still many ways for them to become aware of the Swap It campaign, as it is advertised on TV, radio, billboards, near major roads or on public transport, and near car parks and also in doctor surgeries and hospitals. Therefore, it is easily accessible for all Australians. The Swap It campaign allows individuals to be empowered in the decision-making process of their new Swap It lifestyle, as it is the individual's choice to swap what they would with the information provided as guideline. Also, in the Swap It resources link, there are 12-week planners that can be easily downloaded from the Swap It website. This enables the individual to plan their first 12-week of their Swap It in life, with a plan readily available to encourage the individual to stick to the plan, and they will be less likely to break back into bad habits. Therefore, the Swap It campaign provides information and allows people to develop the skills needed to enable positive change.
Creating supportive environments focuses on the area in which we work, live and play. Also focuses on increasing people's ability to make healthy decisions within these areas. Creating supportive environments is concerned with promoting healthy social and physical environments.
The Swap It campaign supports the idea of creating healthy environments, as it encourages people to practice healthy behaviours in which they work, live and play. This could include swapping driving your kids to school for walking them to the bus stop, swap taking the lift at work for the stairs, and swap your golf cart for walking the course. These are all swap tips outlined on the website that promote swapping unhealthy behaviours in which you live, work and play for healthier options promoting physical activity. These tips are concerned with social and physical environments, which further support creating supportive environments. Also, under the link Ways to Swap, there is an activity finder which helps swappers search for healthy, active activities to become involved around the area in which they live. This initiative promotes supportive environments as like-minded people will be exercising together and supporting each other in order to lose weight to enjoy a healthier life. The supportive environment also comes from the provision of a website and how this website creates an environment where healthier decisions are easier because many people practice the same healthy behaviours which encourage others. Also, the iPhone app can be used to replace a doctor or other support person throughout each day. It is always with you and encouraging you to stick to these healthy behaviours in every environment, even when no one's watching. Strengthening community action focuses on empowerment of the community to identify and implement actions to address health concerns. It encourages communities to work together to set health priorities, make decisions, plan strategies, and implement them, to have greater ownership and control of the health promotion process.
The Swap It campaign focuses on strengthening community actions with all Australians. However, within the links, Swapper resources on the Swap It website, there is a link, Aboriginal and Torres Strait Islander people, that specifically targets strengthening community actions within the community as they are a group within Australia that experiences health inequalities, especially in the diseases of diabetes, CVD and cancer, which the Swap It campaign aims to prevent. As part of Australian Government's Indigenous Chronic Disease Package, messages about eating healthy and physical activity are delivered specifically to ATSI people, though the local Indigenous community to empower the ATSI community to identify and implement these healthy messages. The campaign slogan is Get Active, Eat Good Tucker, Live Longer, which further promote and make the ATSI community aware of the protective behaviours to reduce the risk of these chronic diseases, and then use the supportive these behaviours throughout their day-to-day lives. The campaign package includes a calendar of healthy community days where the Aboriginal community can take control of the health promotion process, development of the Community Health Action Pack, which includes health promotion advertisements for ATSI people to promote around the community, and also a campaign website to showcase local community projects and provide a space which people within the community can discuss and share their ideas and learnings, which encourages ATSI people to discuss and work together on health promotion. Reorienting health services focuses on preventing the problem rather than curing it.
The whole Swap It campaign focuses on prevention rather than cure. Under the first link on the web page, Reasons to Swap, clearly outlines why it is necessary to start swapping and what the campaign is aiming to do. Directly from the web page, it states, health professionals will tell you that an increase in your waistline increases your risk of some cancers, type 2 diabetes, and heart disease. Unhealthy eating and a lack of physical activity can lead to an increased risk of developing a chronic disease, such as CVD, diabetes, and cancer. The campaign directly outlines and identifies the problem, chronic disease, and outlines that it can be easily prevented by swapping simple unhealthy behaviours for healthier ones. Under the Swap Tips link, it has many great swapping ideas which are broken into all sections of the day. For example, swap lying on the beach for walking on the beach, swap fruit juice for a piece of fruit, swap a side of chips for a side of salad, swap board games for ball games. All of these examples and many more give people ideas to swap unhealthy behaviours for healthier behaviours that promote the protective factors of CVD, diabetes and some cancers, healthy eating and increased physical activity. Health professionals are also encouraged to be an active participant in the program. The Link for Health Professionals encourages health professionals to promote the Swap It campaign to groups at risk of occurring CVD, diabetes, and some cancers. It advertises that the doctor refers their patient to the Swap It to use the information on healthier eating, physical activity, recipes, and motivational tips to further support and help them with the weight loss medical scheme that the doctor has given them. Therefore, the health professionals are also an active part in prevention rather than cure. Building healthy public policy relates to decisions made by all levels of government and organisations that work towards health improvements. It includes legislation, policies, taxation, and organisation.
The Swap It campaign is an initiative organised and funded by the Australian Federal Government to prevent the chronic diseases cardiovascular disease, type 2 diabetes, and some cancers. The Australian Government has identified the leading causes of preventable diseases such as cardiovascular disease, diabetes, and cancer within Australia and has initiated the Swap It campaign, advertisement these facts and reduce the individual's risks of living with a disease. The government's aim is to decrease the prevalence of these diseases, place less demand on Australia's healthcare system, and help more Australians live a longer life. The federal government funds all Swap It advertisements which promote protective health behaviours and aim to empower Australians to use this information and practice it in their everyday life to reduce their risk of acquiring a chronic disease. The federal government has also planned, created and implemented all websites, posters and all other media advertisements of the Swap It campaign to further promote and work towards building health improvements to Australia.
The Swap It campaign successfully addresses and follows the all-action areas of the Ottawa Charter in promoting positive health behaviours within Australia that help prevent the chronic diseases of cardiovascular disease, type 2 diabetes and some cancers.
Hi, I'm Eric. If you're like me, over the years, you've started putting it on and on. But the last thing I want is to end up with diabetes, cancer or heart disease. I've got too much to live for, so I've become a swapper. As a swapper, I don't have to lose all the things I love. I just swap more for less, or swap inside for outside. There's heaps of ways.
To help lose centimetres without losing out, you don't have to stop it, just swap it. So start swapping today. For more tips, visit australia.gov.au/swapit. Authorised by the Australian Government, Canberra.